Hi, everyone, and welcome to our virtual health event with UC Health. My name is Hannah Schrepfer, and I am the event supervisor with the Highlands Ranch Community Association. We are so excited that you took the time out of your evening to join us tonight to discuss how to achieve healthy skin. We are grateful for UC Health Highlands Ranch Hospital as a community partner and happy to host this event with their assistance. Before we get started, I would like to go over a few housekeeping items. We are recording this webinar and will send out the recording via email by the end of the week. During this webinar, your microphones will be muted. To ask questions, please type them into the Q&A chat box. This can be found in the control panel of your screen. We will save the questions for the Q&A portion at the end of the event. Our presenter this evening is Dr. Browning. He's a dermatologist with UC Health. And now, without further ado, I will pass the time off to Dr. Browning.
All right, good evening, everybody. My name is Richard Browning. I'm a dermatologist with UC Health, and I work out of the Cherry Creek Medical Center, which is, if you know the Cherry Creek Mall, very close to that location, maybe about a quarter of a mile at most walk from it. So it's a beautiful building. It's only been open about 3 years. There's underground parking, which people very much appreciate, especially if you've ever had to venture out to the Anschutz main campus, which has the Children's Hospital, VA Hospital, and the main Anschutz UC Health Hospital. That area is a bit of a bear when it comes to parking, although that is being worked on. So our location, I think people do appreciate for ease of parking and access to care. The building has a lot of specialists in it, only a few primary care doctors, because most of those clinics are going to be around town, kind of scattered in various locations. And so there are, many specialties in our building. It's also has a lab, an imaging center, and a pharmacy. So it's kind of a nice one-stop shop if you are seeing a specialist. And I also have a colleague in the same practice, Dr. Jacob Whitsitt. So he and I both are the dermatologists in that building. Currently the only two in the area or in that specific building, because there's just not a ton of clinic space left. So actually all the space has been filled. But I do think that over time there may be obviously an expansion in that region, because UC Health is obviously, of course, looking to be able to service more patient needs. So tonight I'm going to be talking about skin and healthy skin and sort of what that looks like, how we can achieve that. We're going to talk a little bit about some common skin conditions. I'm going to give you some information on good products and kind of what to look for when you're choosing skincare products, particular to this climate in Colorado. And before we jump in too far, I'm going to give you a little bit of a background on myself. I am a young guy, I think, or I like to think so, at least. I'm a few years out of residency. So after medical school training, which I did down in Georgia, I was lucky enough to match for residency training here in Colorado, and that brought my wife and I out here about 7 or 8 years ago now. 4 years of training in dermatology, and then I've been now with UC Health for about 3 years, and I've always been in the Cherry Creek location since that began. All right, so I'm going to go ahead and start moving us along. Actually, it looks like I'm in a. Are you able to, oh, there we go. Got it. All right. So one of the first things I want to talk about with healthy skin really is going to come down to climate and what that means for us in Colorado specifically, because definitely various climates affect our skin dramatically. The reason for that is obviously that our skin is our organ that interacts between our environment and the internal part of our body. So it kind of protects our organs. It allows us to sense our environment, which is pretty amazing, and then interact with our environment. And obviously that comes with some risks, because we're trying to keep everything on the inside, and the outside things outside. We're going to talk, as I mentioned, about some products, some common skin conditions, including skin cancer, which is certainly important to discuss, especially in such a sunny state. And then I'm going to have a quick slide on Lichen Sclerosus, because that's actually a very common condition. Well, I shouldn't say very common. It's not an uncommon condition that happens mostly for women and mostly in post-menopausal years. So, typically age 55, 60 and older. And it can cause some, pretty serious long-term issues if not recognized or addressed in a somewhat timely fashion. So we'll go ahead and go to the next slide here. All right, so the first thing to know about Colorado that's important about this talk is that it is extremely dry. This map shows you a nice average annual relative humidity, and you can see based on the blue over on the East Coast and in the Pacific Northwest that there's a lot more humidity in these regions. I came from Georgia down in the Southeast, and that was in Augusta, Georgia, where my medical school training was. The average temperature in the summer would probably be 95 during the day, and the average humidity would probably be 90+%. That is very different from Colorado, and especially for for winter time in Colorado. The humidity I recognize in my home will drop sometimes to about 7%, especially when the heat kicks on. So that does definitely mean certain things for our skin, and we'll talk about that momentarily. The other thing to know about Colorado, as I'm sure you do, is that Colorado is very sunny. So we get on average about 300 sunshine days per year. This map shows you a lot of that kind of just general solar experience that we get and the radiation that probably comes with that. The other thing to recognize about this is that radiation and ultraviolet radiation in particular, which is a huge risk factor for skin cancer, is worse at altitude. So the higher you go in the atmosphere, definitely the more radiation you're getting. So that for a lot of our Colorado folks who are super active, that matters. If you are a hiker, if you like to get up into the mountains, especially if you ever do 14ers, we're talking about probably a difference of 50 to 60% increase in radiation up at the top of a 14er relative to sea level. So that's certainly something to keep in mind, and pack that sunscreen with you if you go on hikes. Hats, sun protective clothing, those are really good ways to try and keep your skin protected, especially at altitude. All right, so we just kind of mentioned some of these things, but one of the things I want to kind of particularly point out is that a daily sunscreen habit would really be ideal for people to get into, especially for high risk areas. So what do I mean about high risk areas? I'm really talking about anatomy of our body. So if you think about what are places that are commonly exposed, what are places that we see a lot of sunspots on over time? That would be places like the top of our hand or the back of our arm, places like our face, our ears, and our neck. Sometimes the V-neck chest for many people's clothing that's exposed. So what I really try to get my patients to do and make a habit of is actually really first finding a sunscreen that you like. That's very key to success. If you don't like the sunscreen product, you're not going to put it on. So if it makes you look like Casper the Ghost, you're probably not going to apply that very frequently. If it's pasty, if it runs in your eyes and it stings, again, you're probably not going to use that often. So you really have to find a product that you like. The key being that you want to choose SPF 30 or higher. And we'll talk a little bit more about that in just a moment. And the thing that I do to remind myself is I put it next to my toothbrush. So then in the morning when I get up, I brush my teeth, I see my sunscreen, I go ahead and put it on, and then I go about my day. If I'm going to be out and about later in the day doing, physical activities outside or at the park or up in the mountains, I always try to bring it with me. But just in case I forget, I actually store one in the glove compartment of my car or the middle console, so that if you do happen to forget and you're on your way up to the mountains, it's okay. You've got something to save your face. The other thing that we just mentioned is that Colorado is extremely dry. So as a part of that dryness, our skin barrier, as I mentioned, is kind of that, barrier between our outer environment and the internal environment. Our body is 70% water or more. So, in order to maintain that barrier and keep what needs to be inside, and what should be outside, we should be moisturizing our skin. I will admit, probably for some people, less of a concern or issue when we're young, because our skin barrier is still very fresh to this world and has not seen some of the abuse that it will over the years. But as we age, our skin barrier is less effective every day. So it is more important the older we get to be moisturizing with a lot of frequency. I apologize, my daughter is just clapping on the door here. So if you hear something in the background, that's what's going on. All right, so how do you know which moisturizers to use? Thicker is better. That's pretty much my motto. So when I tell people choose a good thick moisturizer, really what I mean is I want you to be choosing something that's in a jar. I have a couple pictures at the bottom here of very common brands that are frequently recommended by dermatologists. My wife and I use Cetaphil here, the green and white one, but I think CeraVe is also a great brand. We get ours at Costco. It is much cheaper that way. So you can get usually about a 50% increase in value if you choose a wholesale place like that. Obviously, that doesn't have to be where you buy it from. It's available at most drugstores, grocery stores as well. I do tell patients that pump bottles are not, it's not a problem per se to use that, but I think that's better for places like your face where you have more oil production and more general moisturizing by just kind of the nature of our skin anatomy. And so, you don't have to use such a thick product on your face for most people. I think thicker moisturizers on the face can sometimes predispose us to clogged pores, which will lead to acne lesions. So from some of my young patients, I do tell them maybe try to choose a pump bottle for the face, but for other areas of the body, kind of like neck down, I really do try and promote using a cream, which means it's in a jar and you usually have to scoop that out with your hand. Applying these right after a shower or a bath is really ideal, especially because as we dry off, there's still some moisture on the skin. And by using a moisturizing cream, you're sort of locking that in. All right, so as I mentioned, a face moisturizer does not have to be quite as thick. For most people, again, there are exceptions to these rules. But here I've included two products that I really do like. Cetaphil, again, is just kind of one that I've fallen to over the years, and I like a lot of their stuff. I often recommend CeraVe as well. But these are affordable options. They're usually, honestly, very frequently recommended, not just by myself, but many dermatologists. This one on the right is kind of like a very generic sort of oil-free, you'll see marketing on these bottles for things like combination skin, oily skin, sensitive skin. I will admit, I think a lot of that is marketing ploys to try and get you to choose. I sometimes laugh at these things that are on the bottle, like combination sensitive skin, because I go, well, what does that mean? I think they're just trying to capture any audience. And so I think they use certain words to do so. This one on the left is a brand called Elta MD, which you actually will not find in drugstores or grocery stores. This brand markets themselves towards dermatology offices. They do consider themselves kind of a higher end option. And I think that honestly, the way that their product feels and goes on the skin is definitely a little more elegant than some of the other skincare products that I have tried. Again, there are a lot of brands out there, way too many for us to even keep track of. I think this market is extremely saturated, and a lot of it comes down to how well can they brand and how well can they market it to you as to whether or not it's popular. And that doesn't always mean that it's a better product. So I like this AM therapy one. There's a PM therapy as well. I tell my patients you do not have to choose one for the morning and one for the night. Again, I think that's a marketing ploy, but I do like the way this one feels. And so I do use the Elta MD skincare AM therapy moisturizer for my face, particularly in the winter when I feel that I need more moisturizing. Drier weather, the heat's kicked on. That's usually when you're going to need more moisturizing with more frequency and thicker products. All right, so some sunscreen guidelines. You can see this person here has clearly put on some probably pure 100% zinc, and they are likely about to go on a long swim. This is probably somebody who's about to go on a Ironman triathlon, and they really need that protection long term. So that's why they look like Casper the Ghost. That is a zinc oxide, very likely based on the way it looks. That is a physical blocker. So what does that mean? There are chemical sunscreens and there are physical sunscreens. Many sunscreens now actually have some combination of both. And the reason that they do that is because a physical blocker may not capture necessarily the entire spectrum of ultraviolet light, which is a risk factor for skin cancer. So I do really like to personally use zinc-based products for my face. There are titanium-based products as well that are great. I just know that the Ulta-MD sunscreen that I use is a zinc-based product. It does disappear pretty nicely. So they are not all made the same. That's what I mean up here. You can find, I've tried Neutrogena products that, again, I'm not saying anything bad about that brand. I think they have awesome stuff. And I use many of their body lotions or sprays, but the times I've tried their face ones, especially zinc ones, I find that they just tend to leave a lot of white residue, and that's just not appealing for me and what I do and my lifestyle. And so I pay a little bit of extra money in order to find a product that is more cosmetically elegant. And I'll show you the name of that Ulta MD one. That's my favorite out of their line. I also should comment, I do not get any kickback from Ulta MD. I have no association with them. So it is not because I am making money from trying to push that product at all. Actually, that's not the case. I just think they make nice stuff. When you choose a sunscreen, what I tell my patients, please pick SPF 30 or higher. The reason for that is that there are certainly better protection as you go up in numbers, but once you hit 30, you start to get diminishing returns, meaning that curve of protection starts to fall off as long as you are actually putting it on appropriately and you are reapplying it. So if you're very, very sweaty outside, exercising or working out, and you're sweating off your sunscreen quickly, or you're wiping it off your face, you do need to think about reapplying more frequently, probably maybe even once an hour if you're out at the beach. If you are, just kind of running some errands and you're going about your day, a zinc oxide on your face is probably going to last for hours. You may need to reapply. Obviously, if let's say you're golfing, okay, I think using it at the beginning of your round and then reapplying midway through is a very smart choice. And again, try and make sure you're capturing high risk areas. So, exposed neck, ears. I even actually catch some of the kind of inside portion of my ear, behind my ear. And then face, I also push it up against my hairline because I will often see skin cancers kind of right around that hairline. And then the thing I should comment on is that for anybody with thinning hair, or if you're a lady with a hair apart in your hair, be very careful about that, because I have certainly seen skin cancers on, thinning areas of scalp or along a part line. It's not very common, I would say, in women. It's much more common in gentlemen, probably because they, don't maybe care as much if their hair is thinning, and then they, may not be wearing hats. So I think those are reasons why I often see it more in men. All right, so this is the Ulta MD product that I use all the time for my face. So I, quite honestly, last night I ran out, so I just purchased 4 more. The reason I purchased 4 more is because I put one in places like my hiking bag, my golf bag, my car, and right next to my toothbrush. So I store them in places where I know if I forget one somewhere, but I'm going to be out for a while, I still have access. There are 2 options here with this 46 SPF UV clear one, which is the one I think rubs in the nicest. They have a tinted version. So some of my patients that are either kind of medium to darker skin tones, or that want to be able to use something as sort of like a light foundation, just to, basically in place of a foundation makeup. Some people will choose the tinted option there and use it that way, which I think is completely fine. And in fact, that's really kind of just a personal preference between the 2. Sun protective clothing. I think this is an awesome advancement that's really kind of become more popular probably in the last decade, maybe a little bit longer than that, but it was not something I was that aware of as a kid. You'll see if you're searching for this online, they don't market it as SPF, but rather as UPF. Think of that as really honestly the same kind of number. So, most of these clothes are going to be 50 UPF, and that's completely adequate. Even if you found one that said 30, I still think in my mind that's great. You're very unlikely to get any sunburn if you're honestly wearing that. Clearly, I'm intending that only for areas that are covered. So if you have exposed skin, that's not going to help that area. But companies that make these products, and this is only a few, examples that I'm aware of, but Coolabar, that's a very common one. REI has some great stuff. I have a Patagonia sun shirt or sun hoodie that I love. I've used for years. In the summertime, if it's really hot out, I'll even sometimes bring it with me on a hike. I'll soak it in some water, or if I'm passing a creek or a stream, I'll just kind of dunk it in, wring it out, throw it back on. And then it keeps you much cooler because you're protected from the sun, and the evaporation of the water does make it a really nice way to stay cool and keep that sun off you, so that you're not having to reapply as much sunscreen on your body, which I think is honestly very nice. All right, so we're getting into some of these common skin conditions that I wanted to mention that we can be aware of. Eczema, this is an extremely common skin condition. There are probably, I mean, the quotes that you find online or in textbooks are be about 1 in 3 people deals with this at least some point in their life. I think in our climate, that's honestly a low ball. I think it's probably 1 in 2 people. I mean, I see this all the time, and it has many, many different background causes, but the main way that I kind of tell people to think about it is that it's a breakdown of your skin barrier. So what causes that? Well, genetics can certainly do it. So there are some people with mutations that, some mutations we're aware of, some we probably are not yet aware of, that will make your skin a little more fragile, more likely to break down when it's exposed to things like irritants, or just dryness. And again, I mentioned earlier, our climate's extremely dry. This is something that I see more in the winter. So as I mentioned earlier, thick moisturizers are your best way to combat this problem. Over here, you can see this person's hands have become very red and cracked. This is probably one of the most common times that I see eczema, is going to be an irritant hand eczema. That's most of the time going to be from things like hand washing, dishwashing. So think about anytime your hands are in the water or in hot soapy water, friction is a very good reason for this to happen. So sometimes, people have a habit of sort of rubbing their hands. I think doing that a lot can kind of predispose you to it. I mentioned golf. Sometimes when people play a lot of golf, right, this friction of the club and the rubber on your fingers can do it. People who do things like pottery, that's a common one I see. If you throw pottery, the friction of the clay on your hand and then having to kind of always, clean that off at the end of class, that's a big reason for these sort of things. So you have to kind of, what I try to help people do is recognize in their own life what some of these triggers might be. I think most of the time it's sanitizing and hand washing. And I saw a lot of that. And I think we all did during the pandemic, when people were very scared about the, viral illnesses. And, obviously there's a lot more out there than just COVID. So people wash their hands, as you should, if you use the bathroom or something. But I think people were doing that with a lot more frequency, and that was really causing a breakdown of the skin on your hands. All right, so I mentioned a few of these things, water, especially hot water. So not just your hands, but if you think about, gosh, I'm sitting in a shower and I had a stressful day. What do we typically do? I think we turn that water up a little bit warmer. We kind of sit there and we let it run down our back, because that's sort of a nice, comforting thing. That's a great way to end up with very itchy, dry skin on your back that can turn into eczema. So be wary of long, hot showers. I think you are better off. I'm not saying you need to take a cold shower, but just, shorter showers, maybe less frequency, especially, for folks that maybe work out or shower multiple times a day. That's a big risk factor. Dishwashing. So if you're doing a lot of dishes, I love to cook in my own house. And so that obviously comes with doing dishes. So I think if that's a real common thing and that's really causing problems, think about even some, rubber gloves or something to keep those hands protected just while you're doing the dishes. Cleaning chemicals, that's a big one. So irritants like Clorox wipes, counter sprays, we oftentimes, what do? We grab them with a bare hand and then we're wiping counters down or wiping bathrooms down. That stuff's getting on your hands. And then what do? You wash it off. So those are kind of repeated offenses to the skin. And then I did mention these other ones with the friction. Let's go back a second. There we go. All right. So there are a lot of options for hand moisturizers. I really like to try and get people to think of things that are thick. I put on here an option that I think is helpful at night, because during the day we use our hands so much. It's challenging to keep the moisturizer in place. And especially if you use something like Vaseline, it's so slimy that it's hard to operate. It's hard to like hold a glass of water and, or grab certain things. It kind of leaves a mess behind. So during the day, I often choose, like the CeraVe product on the right there, something like that. I also have used a Gold Bond product I've liked a long time, but they just recently changed the formulation about a month ago, and it's now thinner. And I actually do not like that product as much as I used to. So I'm sort of in search for a new one. At nighttime, though, what you can do if your hands are cracked and really kind of irritated, like we saw in that picture, coat them with Vaseline or Aquaphor ointment, and then put on some cotton gloves. So you don't want to use rubber gloves overnight. It'll trap sweat, and that can often exacerbate the issue. So cotton gloves are still a little bit breathable, but they'll keep that moisturizer in place. You'll wake up with much healthier looking skin, but you do often have to kind of continue that process with a lot of frequency if you really want it to work. All right, psoriasis. This is a very common condition. 1 in 50 people, so 2% of the population deals with this. There are probably some people out there that have, oh, maybe I got a little bit of what they think is just dry skin on their elbows. Could be mild psoriasis. Many times it is just dry skin on the elbows, but sometimes it's not. It can happen in the scalp. So that's what this picture is over on the other side. It can also happen on areas like genitals, the buttocks, the belly button, the shins. So it can really kind of honestly be anywhere on the body, but those are common locations for it. If you think this is something that you have, especially if it's bothering you, I would suggest seeking a dermatologist, because this is something that you really do need prescription medication management for. Moisturizers are really not going to fix this problem. All right, so folliculitis, this is a very, very common issue as well. So I just thought I'd put a slide in on it. This is sort of like a more exaggerated version in this picture, but this is a very common location, which is why I put this in here. So this is somebody's buttock, thighs, basically areas where there's tighter clothing, where there's sweat, where there's friction. So, we sit in a car, we sit at a desk seat, those are risks. If we are bikers, bike shorts are usually tight, and there's a lot of movement of our leg. So that rubbing will sort of irritate the hair follicle, and then you can have bacteria get involved, and it sort of makes a little home, and then all of a sudden it's red and angry. I think many people probably call these ingrown hairs. It's not always an ingrown hair technically, that's sort of splitting hairs here, okay, and no pun intended. But the best way to, in my opinion, manage this sort of issue is going to be this wash on the side here. Not particularly this brand necessarily. I mean, this is the one I use, but I often choose different brands. It's just what I can find at the grocery store. This 10% benzoyl peroxide, that's the ingredient that you're looking for. A warning about this, it's not dangerous, but it can bleach your bath towel or your clothing. So if you use it as a face wash and you have dark clothes on, be very wary of that. I usually tell people it's probably going to bleach your clothing, and I don't want that to ruin it. So it does not bleach your skin, does not bleach your hair. Maybe it would if you left it on for a long time, but not for appropriate use. And so what you should do is probably use it for about 15 to 30 seconds. You kind of put some in your hand. I tell people use it in the shower, just sort of clean that area or wash it around, cleanse that area of your skin where the problem is, or where the problem is often. So, I frequently use it on sort of, bottom, thighs. It's a great wash for acne, on face or upper back. So, definitely you can use it kind of any of those areas. And it really is quite effective if you use it with some consistency. It will help kind of keep these things at bay, so there's less of it, and maybe it keeps it clear, but oftentimes it's still such a common issue that it will still crop up. All right, this one is a very common one. So I'm referring to these as wisdom spots here. I also sometimes tell people they're flowers in the garden of life. I did steal that phrase from a mentor of mine, Dr. Whitney High, who's an excellent dermatologist. And I trained under him for during residency. So that one he told me I was allowed to use. So I've used that phrase over the years, and I think that that goes well with people. Another term you may hear for these ones that are on the left that are sort of reminiscent of it is barnacles. I think some dermatologists use that. I find many of my patients, particularly patients that are a little bit more sensitive to the way their skin appears to other people, don't really like the barnacles comment, which I understand, but I think my Navy veterans love that. They think that's hilarious. So what are these? These are called seborrheic keratoses. The name doesn't matter so much. What really matters is that they are benign. So we're pretty much all destined for these if we live long enough. I tell people maybe not every person in this world is going to have it, but most of us are. Certainly a large majority of us, and they show up with time. So these come a little later in life. They can be as early as our 20s, but many times I start to see them show up in our 30s or later. And then on this other side are what are called cherry angiomas. They're often kind of bright red like this. They're often small, maybe a couple millimeters in size, totally harmless. These things are just sort of there on our skin. And there's something as part of being human is what I tell people, if you live long enough, you're going to get them. So thankfully, they're not dangerous. If you're not sure what something is, especially if it's getting bigger over time, if it's painful or it's bleeding, those would be signs that it's probably not normal or may not be normal. So that's the kind of thing that I tell you, if you're not sure, especially if it's growing, it's changing, it looks weird to you, you haven't seen it before, and you're unsure, seek an appointment with us, and we are happy to help you differentiate what is normal and what is not. Skin cancer. All right, this is a very, very important topic. So it's extremely common. There are 5 million cases of skin cancer diagnosed per year in the United States alone. We have a population of approximately 350 million people. So you can understand that's a lot of people that end up with it. I tell some of my patients that are fair-skinned and blue-eyed, your risk could be as high as 1 in 5, maybe higher, to develop a skin cancer during your lifetime. Thankfully, many skin cancers are the type that you can cut out or treat usually surgically, and your cure rate is very high. So 98%. That's not the case for all of them. So we're going to talk about other high risk types of skin cancer in just a moment, particularly melanoma. That one probably people are aware of and know that name. That one can be very dangerous and can definitely be fatal. So, you don't want to sort of act like these are not a big deal. I mean, I tell my patients, I try to appropriately counsel them so that they're not overly anxious about certain types. But these are things that definitely show up. So, if something is growing, it's bleeding, it's painful, it doesn't heal very well, I think that's something you should be suspect of, and it's worth getting looked at. What causes skin cancer? Not strictly sun, but almost strictly sun. So the sun is a wonderful thing. It makes me happy to be in the sun. It makes our plants grow. It makes the world a wonderful place. And we need its energy to really honestly do a lot of what we do. But it is a risk. So the UV radiation that comes from it is the reason why we get sun damage on our skin. And that creates a lot of changes that people also don't like that are benign. So sunspots, what sometimes people call liver spots, sun is a big reason for that stuff too. So if you're trying to keep your skin looking young, the best thing I can tell you is sunscreen, sunscreen, sunscreen. So time is the other risk, right? The more time we are live, that means the more cumulative sun exposure we have had. 90% of skin cancer is going to be in those 40 and older. I have seen even, the type of skin cancer that would usually happen later in life. I've seen that happen in people as young as 19 that are fair-skinned, that are maybe using tanning beds or laying out on the beach or, just laying out outside and trying to get tan. I tell people that is not a good choice. You have the skin tone you have, and that's really ideal to try and keep it that way. We're not all blessed with dark skin if that's what you prefer or like. And, that's a sort of misconception, I think, from decades ago that we've sort of tried to steer people away from. All right, so I'm going to show a couple pictures of common skin cancers. This is the most common type by far, called basal cell carcinoma. It's this is an example right here under this person's eye. So this would be a very common location. These tend to have, as you can see in the center, kind of like a broken down area of the skin. That's usually once they're a little bit further along. This one might have been there for anywhere between many months to maybe even a year or two. Sometimes they're slow growing enough that they're there for years. But if you're not sure if it's a bump that keeps getting bigger, as I keep mentioning, it bleeds easily, maybe it doesn't quite heal all the way, that's something I think is worth looking at. This is an example of a squamous cell carcinoma. I recognize this photo is not that different to the lay person when it comes to this versus a couple slides ago when I showed you those wisdom spots. So again, if something gets bigger, it's painful or tender, it bleeds, it's something you should definitely get checked. So squamous cell carcinoma is less common than basal cell, but still very common. And that one is a little bit more dangerous. So it grows a little faster. It certainly can move to other parts of the body. It's higher risk if it's on a location like the top of your ear or anywhere in your ear or your lip. So those are locations that if you have a mass that's growing on that spot and you're not sure, seek out a dermatologist's opinion. All right, this one's the big, bad, scary wolf. So this is the one that we really try and tell people about a lot. So it gets a lot more, I think, publicity than the other types of skin cancer. This is melanoma. It is often recognized as being irregular in shape like this. So this is kind of a funky border. There's notches in it. It might look like a strange island. There are multiple colors in this. That's usually not a good sign, not always a problem. Some of those wisdom spots can have multiple colors. If I'm not sure when I look at somebody's skin, what do? I biopsy it. So we take it off and we look under the microscope, and that's a great way to find out. So melanoma is not something you want to mess around with. If you've got a growth that is dark and irregular and asymmetric, it's growing and changing continuously, that's the kind of thing you should get looked at for sure. And early detection is most important when it comes to melanoma. That's really what helps the most because these cancers do continue to grow. Many times, thankfully, they grow laterally on the skin before they dive down. But there are some subsets that are the kind that unfortunately do just sort of grow straight down and they don't spend a lot of time growing sideways. The depth of it is really what kind of gives you your best information on, is this really bad or just kind of bad? And I say that because thankfully, if you catch it early, melanoma cure rates are surgical removal. I cut it out, we stitch it up, and those can be big scars. I tell people you should look like you got a shark attack or something if you had a melanoma, because those are usually multiple inches long. I mean, I've done excisions for patients in the clinic that are probably 7 inches long for deeper melanomas. If they're more advanced, we have to start talking about things like checking your lymph nodes in surgical procedures. So removing some lymph nodes in an area nearby and checking that, or even having to go through not traditional chemotherapy, but a newer treatment that's called immunotherapy, kind of unlocks the immune system and allows it to try to kill these things off, which is a very cool way of doing it. All right, and then Lichen Sclerosus. I did not include pictures of this one. I just didn't feel like in a talk like this, that was probably most appropriate. And the reason I say that is because the location is most of the time going to be the genital area for women. That's not purely true, but almost exclusively. It is an autoimmune condition. So it does mean that your body has, for various reasons, decided that there are certain parts of the skin that it thinks is not normal, and it does start to sort of make changes to that skin. What are those changes? Oftentimes they're white patches, but not always bright white. They're usually very kind of thin skin areas. So over time, that skin becomes thinner and thinner. Many times women will say, it's really just like super irritating or very, very itchy in that area of either the labia, sort of, so it's not internal genitals, but the external skin around it. It can even affect the area around our anus. So where we use the bathroom to go number 2. And in between those two areas, the front and the back, those areas can be involved as well. So, if you find yourself with super irritated, itchy skin, and it's not the only reason for itchy skin in the genital location, but it can be a cause of that. So, pain with intercourse, burning with urination, oftentimes that one is more of like urinary tract infection. But if it's more of the outside area, irritation, itching, you find yourself waking up in the morning with kind of blood on the sheets because you've scratched in the middle of the night. Sometimes those are reasons why I tell people, yeah, maybe that should be looked at. This is something that's OBGYNs, not every OBGYN manages, but some of them manage it. And I will also tell you that not every dermatologist is comfortable managing this. I think a lot of that comes down to our specific training and kind of what we were exposed to during our years of training. Because I think once you get out of that training and you don't have somebody watching over your shoulder to help you out, it becomes more challenging to feel comfortable with things that you've never seen before. This is something I treat. I certainly don't see tons of it, but I see it not infrequently. And I will sometimes have referrals from an OBGYN if they're not sure what it is. And I will sometimes help diagnose it and then sort of get people down the right track. All right, so in summary here, sunscreen, SPF 30 or higher, that is definitely important. Sun protective clothing, so hats, long sleeves, pants, that kind of thing. Choosing lighter weight clothing that's UPF would be great in the summer. Moisturizing, if people are itchy, this is the first, second, and third thing I tell them to do most of the time. Obviously, again, there are other reasons people can be itchy. Eczema can be very itchy. Psoriasis can be itchy. Sometimes bad problems like a leukemia or a lymphoma can cause significant itching. So there are obviously other reasons for that, but in our dry climate, I will tell you probably 90% of the time, it's because people are not moisturizing, or they're choosing an ineffective moisturizer, or they're not using it often enough. And then the other thing I tell people, especially as we get older, I think it is important to get skin checks. Doing that about once a year, I think is often important. If you have a history of skin cancer, considering doing that more frequently, and obviously at the discretion of your dermatologist and you and that person talking about kind of what makes sense for you. But for my patients that have a history of skin cancer, I often tell them I need to see you twice a year, so about every 6 months, and we kind of check you head to toe. All right, that completes the talk.
Thank you, Dr. Browning. We will now go ahead and take some time for questions. Just a reminder, please be sure to type your questions in the Q&A chat box in your control panel. And we do already have a few questions in the queue. The first question is, what are your thoughts on HelioCare pills as sun protection?
Yeah, that's a great one. All right, so HelioCare is something that I did not hear about until probably about, I'm trying to think, maybe 4 or 5 years ago. It's a plant extract. I forget the name. I think it's polypodium, something around that name. But it has been studied as being an option for sun protection. The idea being that when you take the pill, it's absorbed into your body through your gut, and then it sort of distributes itself into your skin. It does provide some SPF protection. Now I say some. I remember at a conference a few years back, some dermatologists wanting to try it out, and they took a couple of them and went out and played a round of golf. I doubt that it gives you the same protection as sunscreen. In fact, I know it doesn't. The SPF that's provided by that is certainly lower. I know some dermatologists that, especially surgeons that do just skin cancer removals, some of them tell every patient go out and buy this stuff. That's not something I tell people, because I think honestly what it does is kind of lulls you into a false sense of security, as if, oh, I'm just going to take this pill and go about my day and I can spend 10 hours on the beach and I'll be fine. That's a misconception. So don't use it like that. Could it be used in addition to sunscreen, or, potentially as a daily thing if you're not getting much time in the sun? Yeah, I think it can add protection. But I guess the issue that I still see somewhat with this is that it's a relatively newer agent. And with any, plant extract that we consume, some people have side effects to that. And I think that's not yet well studied. That probably hopefully isn't major issues, because I'm not aware of anything off the top of my head that's a severe problem. But I certainly think, just like with any any product, there can be side effects. So it's not something I routinely tell people you should go out and buy or take, but I think it can provide you some additional protection.
Great, thank you. And next question I have is, can you get rid of barnacles? Is burning them off an option?
Yes. So burning them off is an option. What people really mean by that is probably the canister of spray that many dermatologists will just walk into the room with immediately. I'll tell you, I probably bring it into my room for most patient cases. The reason being, it's a great way to treat pre-cancer changes. So kind of before skin cancer, that's often a treatment for it. You can use it to treat quote unquote barnacles, but I actually tell people, many times what it does is if you treat it, it's not always going to get rid of the barnacle. So maybe it peels off and that's great. Maybe it doesn't. I often tell people too, if you treat a lot of them, your insurance company is likely to recognize that we are doing something that is cosmetic. They know that we know these things are benign. So I tell people, if there's a couple that are, particularly bothersome or inflamed or irritated, fine, I'm happy to treat that, knowing that there could be some discoloration left behind or knowing that it may not go away completely. I think if you're really interested in trying to get rid of a bunch of these things, I tell you should seek out a cosmetic dermatologist. That's somebody who may have other options besides just burning it off. And they, obviously do that more frequently. And then you're less actually likely to pay more, because if your insurance denies it and that we tried to bill it as a medical thing, you're actually likely to pay more money than if you just went to a cosmetic person and you paid cash.
Okay, great. Thank you for your input there too. Next question, we have a bunch, which is amazing. Are moisturizers containing fragrances as effective as those that are fragrance free?
Yeah, good question. Fragrance, I think, is often a thing that's a culprit for allergic contact dermatitis, which is sort of a form of eczema that happens from certain chemicals. Not everybody has a problem with fragrance. That's the first thing I tell people. I mean, I use cologne that's got fragrance. I don't have a problem with that. I think many people don't. But if you're having an eczema problem, and obviously if you see a dermatologist and they say, well, I'm suspicious this could be an allergy related issue, it is possible that fragrance is up there on the list. So I think if you're not sure you have sensitive skin, using fragrance-free products is sometimes more beneficial. And I think many times if we as dermatologists suspect you're having allergic contact, before we do the patch testing or refer you for that to get that figured out, we do tell people using fragrance-free products is safer during that time, because that's a likely culprit. But it doesn't necessarily mean that a moisturizer is more or less effective because it has fragrance or doesn't.
Awesome, thank you. And next question, what are your thoughts on the LED red light face mask for anti-aging benefits?
I just got this question recently in the clinic. I've done some research into this. That one's a tough one still, because that's, I think, again, a newer recommendation. I think in Europe, it's been around a little longer. People have been using some of these things for acne treatments. I have seen, definitely there's websites where, again, mostly cosmetic dermatologists are sort of marketing these things as being yeah, absolutely, you should do this and it's going to make you look younger. I'm not so sure about that. I definitely don't think there's anything, I'll be honest, besides maybe laser procedures, usually intense laser procedures that are going to kind of wipe away sunspots or try to improve wrinkling. That's the kind of thing that, honestly, if you're willing to spend the money and the time and effort, is probably going to get you your most effective benefit if you're looking for cosmetic improvement. But I think I'm not really sold yet on that kind of product. I will admit I think I'm a little more pragmatic about the way I approach skincare. I don't routinely tell people to go buy these or use these. Are they likely to be harmful? Probably not, based on the information that I was able to read and find it's not really quite in the UV spectrum. So I think it's not likely to be harmful, but I still just don't think there's enough evidence or information on that one yet. So I sort of have to hold back what I say a little bit on that one.
Great, thank you. Next question we have is, how do you recommend applying/layering products, especially at night? Is it important for treatment products like tretinoin to soak in for a certain amount of time before adding moisturizer?
Great question. Yeah, that's a common one that I get to. I tell people, think about moisturizers or sort of any products like that as a barrier. to some degree. So if you have a medication or really particularly a prescription medication that or a vitamin C serum or something that you're trying to get the most effect from, that thing should probably go on first or earlier in your regimen. So, for me, if I'm using tretinoin, I'm going to put that on before I put on a moisturizer, because in my mind, I think, well, moisturizer is probably going to act like a barrier, and then the medicine is less likely to absorb. So the time frame, as far as kind of how long do I have to wait, that one, I think, honestly, if you just spend 20, 30 seconds kind of rubbing the tretinoin in and you feel like you've really kind of gotten it on there, in my opinion, I think you can use moisturizer relatively soon after, probably within a few minutes, and that's okay. So I don't think you have to wait 30 minutes and then do the rest of your regimen. I just think that's also unrealistic. I don't think people have the time in their night to do that. So I usually put medicine first, moisturizer after.
Awesome, thank you. Next question we have is, where can I buy Elta MD therapy?
Yeah, good question. So we sell some of these products at the Cherry Creek Pharmacy in the medical center. Not every Elta MD product do we sell there. I think we sort of had to pick and choose what we want to keep in stock. I actually get these products from Amazon. And the reason I do that is because with Elta MD's website, they actually kind of make physicians have some sort of like contract with them in order for you as a patient to be able to buy direct from them. But they must have some sort of contract with Amazon, because they sell it on Amazon now. And although I will admit I probably buy too many things from Amazon, because the ease of doing that, it is a nice and easy way to get it delivered straight to your door. So usually it's going to be accessible at a dermatologist office or a place like Amazon, because it's not available in a Target or Walmart.
Okay, awesome. Great to know. Next question is, my derm says I have nostalgia paresthetica. I have continuous mid-back itching, which drives me crazy. What should I do, or what should I use?
Yeah, that's a common one as well. That one's tough, because that's really actually not particularly a skin problem. That is a nerve problem. And what I mean by that is usually what that is some entrapment or kind of aggravation of the nerves that are likely coming out of the spine. That's frequently seen. The older we get, we see that more. And the reasons for that are our spine, as we age, we start to do this. So what do? Our compensation is our spine shrinks a little bit, it gets compressed. And then the other thing is that our posture becomes a little bit, not as good as it once was. And so those things, I think, play a role, because those nerves are being sort of pinched in that area of the back. And that's likely what's triggering a lot of that itch. It's super aggravating for people, and I do not have any good topical options. In fact, even pills by mouth are probably not a good choice, because it sedates you. It makes you sort of have mental fog. So that one, I think probably honestly a better approach is, if you have not had spine surgery or neck surgery or significant injury to your spine, I tell people doing things like yoga, stretching, soft tissue massage, foam rolling, anything that can try to break up that tighter muscles and maybe, give you a little more flexibility in your spine, working on your posture over time. But it's a tough issue, because I think, once it's present, and especially if it's been there for a long time, or if you've had spine problems or compression of discs, that's not necessarily a problem that's going to go away.
Great, thank you. Next question we have is it possible to over moisturize? I use a moisturizer after I shower with body oil due to the dry weather.
Yeah, I would say I have really not seen any over moisturizing issues. I joke that, it's impossible to overdose on moisturizer. So I do say that to many patients, trying to help them understand that they need to be using it with frequency. So I think what whoever asked that question, I think, what you're doing is totally fine and appropriate. The only time I tell people maybe it's an issue is if you're using really thick moisturizers like Vaseline on an area like your face, if you have a problem with acne, because a moisturizer that's that thick can clog pores on a place like your face, and that can contribute to acne problems. That's more so an issue typically for teenagers or young adults, and less so as we get older, which is why I kind of mentioned some of the pump lotions are maybe a better choice for face skin.
Great, thank you. And next question we have is, I have a growth that is on the side of my face. It feels like a callus. It is a little red on the edges and white in the middle, like dry skin. It is not itchy, and it is right on my face where my sideburns are. I've shaved it off and it comes back. What do you think it might be?
I think that's something that needs a dermatologist look. So whether it's me or somebody else, that thing should be looked at. It's very possible it's a benign growth. It's also very possible that's either a precancer change or a skin cancer. So that's the kind of thing I tell people you need to be seen in person for. That's really honestly the only way to evaluate that.
Thank you. Next question is, how do you distinguish between eczema and an inflammatory breast cancer rash? And what type of doctor should I see, a dermatologist or a gynecologist?
Yeah, that's a good question. I think, breast centers, as they're often known, are places where if you're concerned it could be a breast cancer issue, that's not a bad place to go. I think a dermatologist could certainly also help you answer that question. So actually the answer there is probably either. I have thankfully rarely seen inflammatory breast carcinoma. That's a trained dermatologist is likely to be able to differentiate, but if not, a biopsy of the skin would be the most helpful way to determine that.
Okay, great, thank you. And next question we have is, how do you distinguish between eczema and oh, excuse me, I already read that one. The last question we have, is there a way to get rid of skin tags at home on your own?
So yes, there are, but I'm going to give you a caveat there because there's a lot of products, anybody who can make money out there on the internet or by selling a product is willing to do so. I have seen marketing for things like remove your own moles at home by burning them off with this, acetic acid or, apple cider vinegar. I don't recommend that. I think that's a bad choice. And I'll tell you why. I think, the layperson is not, unfortunately, good at being able to identify what's a normal mole, what's a skin tag, what's an abnormal mole. And the problem is if you start willy-nilly treating these things on your own, you might be trying to cut off part of a melanoma, and you've just made it very challenging for your doctor to then decide or know, was that thing a problem or not. Now, I do tell people if they see me and I see skin tags on them and they say, I don't want to pay cash to treat these things. I get that. I'm very understanding of that. So, I might just direct them and say like, yes, these things right here are skin tags. If you decide at home that you're going to take nail clippers or sharp scissors and just snip that thing off, that's of your own choice. I'm not suggesting that maybe you do that. I sort of tell people that's off the record. But yeah, many times if somebody says, oh, I have this skin tag and I just sort of want to get rid of it, it's not always a skin tag. Many times those are moles, and I tell people we got to biopsy that. Like if we're going to take that off, we got to still make sure it's normal, because I've been surprised sometimes. Sometimes normal looking moles turn out to be a weird melanoma or a situation that you shouldn't have just taken off and thrown in the trash. But there are methods to do it. Many times we just cut them off, we freeze them off. I've heard of people tying floss or fishing line around these things and sort of strangulating them, and then they just die and fall off. Plenty of ways that people get creative to do that, but I do not suggest doing that on your own unless you've confirmed with somebody that knows what they are first.
Great, thank you. And it looks like we've answered and covered all of the questions here. Friendly reminder, this webinar has been recorded and we'll be sending out the recording through email by the end of the week. Thank you again to UC Health for giving us the opportunity to learn about how to achieve healthy skin. And thank you to all of those who joined us tonight. Our next virtual health event will be on Wednesday, May 3rd on exercising and aging. We hope you have a great rest of your night, and thanks for joining.